I want you to listen now to the story of Alice Litman, a young transgender woman as told by her dad, Peter. The Litman family feel that transgender healthcare in the UK is not fit for purpose. A young person referred today for gender-affirming care, for example, would not have their first appointment for 20 years if the waiting lists stay as they are. Faced with that, Alice took her own life. A coroner has ruled that significant barriers which prevent transgender people accessing care contributed to the decline in Alice's mental health. Her family say that whilst they can't bring Alice back, they can keep campaigning to ensure transgender people get the care they need. They want to give the real story of the young people suffering behind the controversial headlines. Peter, let's start by talking about Alice. Tell me about her.
Yeah, it's really hard to summarise her. Obviously, I'm her dad. She was lovely. She was always a kind of a gentle and quiet child, a bit of a fish out of water in our family. They were quite a noisy bunch, so she was always the quietest. Yeah, she was lovely. And then as she got older, she just got a little, and she hit her teenage years, was when we noticed that she was changing and just becoming a little bit more withdrawn and more difficult to talk to.
When you talk about the change in Alice and when she finally felt ready to tell her parents that she was transgender, what was that conversation like?
To be honest, it wasn't a very straightforward conversation. Alice first came out to her sister when she was 15 or 16. And her sister was very supportive and told her to go and see a GP, to get herself on the waiting list because she was going to be on it a long time. But Alice didn't feel ready to talk to myself and my wife at that time, but she did go and see her GP.
She knew what she wanted, she knew she was transgender, and just didn't feel at the point of discussing it with her parents, but she did want to talk to medical professionals, those who would support her at the start of this journey. And what she was finding, that yes, there was love and support for her at home, but the support wasn't there elsewhere. And I'm talking about, you know, the NHS and gender-affirming care. What was she struggling with there? What was that like for her? What was she not getting?
I mean, it's a whole range of things you're not getting. It's actually just recognition in the first instance, to be recognised and accepted for who you are. So I think, I mean, one of the things that's come out in the inquest, or we hope is coming out in the inquest, is firstly the recognition of the length of wait there is in this country before you get seen for gender-affirming care.
Because when you think of NHS waiting lists, you think of 2 or 3 years, but in this case, it's something like...
Well, the GIC accepted that with the current wait list and the number of new patients they're seeing a month, that if you were referred tomorrow, you would be on the waiting list for over 20 years before your first appointment. The
trans healthcare system, you believe, isn't fit for purpose, and given the number of young adults going through this in the UK, that is a massive problem.
It is. It's a huge problem. I feel so sorry for anyone in Alice's position where you're really just being, you're being told you don't matter, that we don't care. There's no service provision. One of the things that the coroner brought out was, you know, if every term, wherever we turned, it was always, we can't help you. And it was like, well, if you can't help us, who can? And there was never an answer to that question. The coroner said at the time of her death, Alice had been on the waiting list for gender identity services for 1,023 days, which
contributed to a decline in her mental health. Your wife, Caroline, said as part of the inquest, we believe that if Alice was able to access gender-affirming care when she first went to her GP back in 2018, she could still be with us today. Alice had a number of suicide attempts, but took her life last year. When you heard all of that at the inquest, how did you feel?
Well, we felt validated because that's what we'd always believed. And to be honest, we felt like Alice's story had been listened to by someone in authority for the first time. I don't think that Alice had ever really been listened to by anyone she'd seen in an official capacity. And I think that wears you down. I mean, it wore us down as her parents, the constant fighting and battling and being turned down and rejected. But how that must feel for a young person who has this huge journey on their shoulders, to be constantly, effectively told you don't matter. And eventually, sadly, Alice believed that.
You want to share Alice's story to humanise those headlines, because while, you know, the trans population might be less than 1%, which is a figure people keep coming back on when they say, why are you talking about this so much? This is why. It doesn't matter if it's less than 1% of the population. These are real, you know, real people.
And actually, less than 1% of the population is quite a lot. The head of the GIC likened it to the percentage of the population that have red hair. We all know someone who's got red hair.
Yeah, someone sitting not too far away from you.
Yeah.
What would you say to parents starting this conversation with their child or navigating the journey? I know that's a difficult one because you probably don't want to offer advice, but they may find some comfort in hearing from you in terms of what you would say about the support that they can give, because your family sounded like you did everything right by Alice.
I mean, I think the main thing you can do, which is pretty universal for parenting, is listen. Is listen and love. That's all you can do, really. And you're not alone, and your child's not alone. Encourage them to seek support from the trans community. Educate and seek support yourself.